It is time for our visit with Dr. Kavanagh. Dr. K is a retired physician and founder of a group that is a national group now called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
And how are you?
Doing very well. Thank you.
That's good. Now, cases and deaths are dropping. Positivity rate just barely over 7%. That's terrific.
Well, it is. I can't tell you how relieved it is, and I hope this continues. In other words, we still may see a bump from the Super Bowl parties, but I think we had enough messaging about that maybe that's going to be very small if it takes place at all. But cases have dropped over 50%, and deaths are also starting to drop. Remember, deaths are lagging indicators, so they still may be high, but when you look at what the cases are doing, I would suspect the deaths are going to continue to drop to a much lower level than what we're seeing right now.
Now, is this directly associated with what? The shots? With the vaccines?
Well, I think that is certainly happening. I think people are getting the message about wearing masks and social distancing. Now we're having a debate whether you should wear 2 masks as opposed to if you should just wear 1 mask. And believe me, even 1 mask will help. And so that is a much better place to be in. And also we're getting over this surge that we saw over the Christmas and New Year's holidays. Some of what the virus does isn't dependent upon our immunity or the virus, but our behavior. And as we've gotten beyond that danger point of having these public gatherings and drinking and partying, that has resulted in also a decline in the viruses.
Okay, well, that's good. That's good to hear. And we've got, is it 200 million more doses coming?
That's correct. President Biden has not only contracted for an additional 200 million doses, 100 million from Pfizer, 100 million from Moderna, that are going to be here by the end of June. But the 100 million doses which were going to be delivered by the end of June, that delivery date moved up to the end of May. So he's actually accelerated the schedule and has gotten more doses online. So this is still several months to weeks out for some of the people in the United States, which is unfortunate, but the light is at the end of the tunnel.
Fantastic. Now, some negativity involving, was it the, which one, was it the Pfizer product that they said wasn't getting the job done as much as they had thought, or was it one of the others? I don't want to misspeak here.
Well, there was some concern over the vaccines as far as getting the new variant viruses out of Brazil and out of South Africa, getting those variants taken care of, that they may not be as effective with those. In other words, you still may get sick, but hopefully not deathly sick. They do feel that they're active, but not where they need to be. And Jack, that's one of the reasons why we've got travel bans on those countries. England, UK has travel bans on the South African nations and the nations around South Africa, along with Brazil. And if you're on one of these red list countries, you can't come into the country. And if you're a resident trying to come into the country, in other words, coming into the United Kingdom, you're required to pay over $2,400 in quarantine fees to stay up at a hotel for 10 days before they'll even let you in to get to your residence. So they're very serious about keeping this Brazilian and South African strain out of their country.
Now, going back to masks for a moment, I am still amazed at the number of people that I run into, and I'm sure you've seen it too, that have the mask down under their nose. I mean, how could you not know, have a television or a radio or even talk to people and not know that's the improper way to wear the mask?
Well, yeah, I mean, it is somewhat crazy, but Jack, I think it goes back to the beginning of the pandemic where there was a lot of mixed messaging. They were saying that this virus is spread primarily through spit or droplets, and people think, well, that comes out of my mouth. We now know this virus also aerosolizes. If you read the CDC advisories on their website, if you read about masks, right now they're talking about aerosols. And aerosols are much smaller viral particles. They can go out the sides of the mask. And that's one of the reasons why you need to have your mask being well fitted and over your nose, because aerosols can float in the air for hours. They can survive for long periods of time, for hours, and they are dangerous. They can spread the virus. Now, you also can spread it through the droplets and spit, and this is why wearing a mask will also protect others, because you don't want that sort of spread to happen either. And droplets can also survive in the environment, land on substances. It could be picked up by other people, and so that's also a concern. With these new, more infectious variants, we're really not sure how they're more infectious. So advisements on how to prevent spread, we're really going back to the start, to the get-go, where we have to be very, very careful. So wear a mask plus social distance. The 6 feet social distancing is for droplet spread, and wearing a mask, which is multiple layers, tight fitted around the sides of your face. You cannot have holes between the mask and your face. That is to try to cut down on the spread of aerosols.
All right, we're just getting an auto tech service text from Joyce. Can you get a medical exemption from taking the vaccine?
Well, yes. Well, first of all, there's not a requirement to take a vaccine, so there's really not an exemption, but there are people who can't take a vaccine because of their immunological status. And if that's the case, then certainly you can get an exemption. But that is one of the main reasons why everybody needs to take it, because similar to other infections that we have vaccines, there's a certain segment of the population that can't take the vaccine, and they need other people to be vaccinated in order to protect them.
Now, I understand this is sort of new. CDC saying that if you've been vaccinated, had the full vaccination, and I would guess the one dose on that one product or the 2 doses on the other ones, you do not have to go into quarantine after being exposed to someone that has the virus. Is that correct?
That's correct, and this is primarily spurred by new studies. The primary one out of Israel, which is showing that once you're vaccinated, even if you acquire the virus, you have less of a chance of spreading it. Now, I assume that they're still advising that the people who are vaccinated wear a mask. So they still may be able to spread a little bit of the virus, but if they wore a mask, that would take care of it. Therefore, they don't have to be in quarantine because their chances of spreading it are much less. But I think we'll see other advisements coming out that are more in line with that one regarding what you should do after you're fully vaccinated, because we're just learning that now. So those type of advisements are going to change as we get more experience with these vaccines.
The doctor said I haven't said this word for a long time. Help me.
Hydroxychloroquine.
Yeah, it said it doesn't work, but new studies show that it absolutely works. What is your opinion on that?
I'm not aware of those. The only studies I've seen are 9 randomized controlled trials which have found it not to work, which is extremely strong evidence that the drug doesn't do much. There is a new drug out called tocilizumab, which is found to have some effect, and that is an anti-inflammatory rheumatoid arthritis type of a drug, which a study out of Oxford has shown that this can slightly reduces by about 4% the fatality rate of COVID-19 infections. So in other words, 14% less people will be dying. And that's important. It's just a little bit towards the good side, but I would take that if I was severely ill. So that, I think, is another drug, along with remdesivir, that's going to go into the armamentarium of treatment. But we do now have good drugs which have been shown to be effective by randomized controlled trials, which we need to rely on, not the ones which are being pushed by social media, because social media is highly, highly unreliable. There are a lot of outside bad influencers that are trying to really distort the type of information the public gets. So please do not rely on your social media feeds.
Here's our question of the day yesterday, and I intentionally held off mentioning this until you were on with us, was this: are you more or less likely to want the COVID vaccine than you were at Christmas? Are you more or less likely to want it? 39% said about the same. 36% said the variants that keep showing up make it more important to get the protection. But 25% said less likely. I've seen reports that make me think twice. Now, are these reports that people are hearing that people are dying from taking the vaccine?
They may be, but here's the thing. When people call up and say that, it's a single person. This person got the vaccine and a week or 2 weeks later died of this type of event. Tens of millions of people have been vaccinated. So if you get tens of millions of people vaccinated, you're going to have a person now and then die of other causes that they'll relate to the vaccine. When you have right now around 3,000 people dying a day of COVID, with even more infectious and severe variants on the horizon, to not get the vaccine, in my opinion, is a very bad decision. And unfortunately, with this type of virus, we will need 75 to 80% of the people vaccinated in order to reach herd immunity. So it's going to be tough. And you should also realize that back several months ago when we were a little bit cautious about, we only have 2 months of data regarding the safety of the vaccine. Right now, we have many more months of data because they keep tracking these patients. We're now approaching 6 months. No major problems have arisen.
All right, got a bunch of texts to get to, Doctor. Let's start with this one. And this is a legitimate question, I believe. I'd love to hear your response, Dr. K. Todd says, why stop at 2 masks when if you do 10 masks, that's 5 times better than 2 masks? How do you respond?
Well, that's kind of what I think the general public will be thinking. But I agree with Dr. Fauci on this one, is that the most important thing is wearing a mask which has multiple layers. The idea of the second mask, if you go on to the CDC's website, is not that it's increasing the filtration aspect of the mask so much as it is pushing the sides of your first mask back along the sides of your face to protect leakage from around the sides of the mask. So it has to do more with getting that first mask to fit better rather than actually increasing filtration. Although it may do that some, but remember, if you just block the front of the mask and the sides are open, then you're just going to enhance the aerosol spread along the sides and open areas of the mask. So you want to close those areas between the mask and the sides of your face. And try to get a good mask. Right now you can order KN95s online. Now and then you can even find an N95 mask to order online. And of course, surgical masks are also available. So you do have choices other than a simple cloth mask. Now, a surgical mask is mainly designed for droplet spread, and so it will have sometimes holes and leakages along the sides, and so you need to make sure that that fits better, and that's why another mask over that to try to secure that surgical mask a little bit better might be a good idea. So that's the idea of double masking.
All right, someone else wants to know if you're still recommending wiping off groceries, mail, etc. before bringing it into the house.
Well, I think with the new variants, we need to go back to the get-go as far as being very, very cautious. I do not know how the United Kingdom variant, which is the B117 variant, how it is more infectious, whether it survives longer in the environment on objects. So I would go back to being more cautious. So I don't know if you have to necessarily wipe off groceries. We tend to let ours sit out for a couple days. Certainly when I bring them out and unpack them, you want to wash your hands very good before, stowing your groceries away. And then after you do that, you want to wipe your hands again. And a lot of this washing of the food and care that you should be taking, you should be doing anyways. Because remember, there are other types of foodborne infections than COVID. You've got salmonella, you've got E. coli. All of that dictates you wash your vegetables, you take good care and good sanitization of your counter surfaces, you make sure that you wash your hands after handling meat. All of that you should be doing anyways.
We got another text wanting to know if one of the side effects of the vaccine is nervousness. Have you heard that?
I have not heard that, but believe me, you may get nervous anyways from getting a vaccine. So that's going to be hard to tell. No, I have not heard that. Fevers is very common. So is myalgias or arthritis. In other words, some achy joints. That's common. And also feeling extremely tired. So I would plan on taking the next day off after you get, especially the second dose, because similar to the shingles vaccine, it hits some people harder than others.
Here's another text before we run out of time here. We're getting close. Has the doctor mentioned England has put a ban on travel from South and Central America? You have to be quarantined for 10 days and then be tested 3 times before allowed to enter the country. The Biden administration has announced asylum and opened the borders for Central and South America while talking about banning travel from Florida. Can you make sense of that?
Well, we have talked about the UK travel bans earlier on in the show. Certainly, I think having borders open during a pandemic, that's problematic. You're going to have to do that in such a fashion that you have people quarantined just because you come through the border as opposed flying in. If you are exposed to the virus, that is something that needs to be considered. So yes, but one of the things you need to remember is that if you fly by airplane from Brazil, that is going to be an exposure that occurred maybe 4 to 6 hours prior to entering the United States. If you come across the border, you're probably looking at several weeks. Not necessarily, but probably. But that doesn't negate the fact that people entering the country need to be screened no matter what mechanism they're taking to enter the country.
All right, got about 15 seconds. Wrap us up.
Well, I think that we're in a much better situation than we were in the beginning of last year and even the end of last year. So I'm very encouraged, but we do need to keep our guard up and we do need to do everything we can do to inhibit the variants from South Africa and Brazil coming into our nation until we get the boosters for those variants.
All right, thank you very much. Talk to you Monday.
Thank you, Jack.